Welcome to the Cardinal HCM 2024 Affordable Care Act Process Forum for Agencies. Thank you for taking the time out of your morning to join us. My name is Elizabeth Dustenberg, and I will be one of your facilitators today. Our webinar today is scheduled from 10 a.m. to 11:30 a.m., and we have a lot of information to share with you all today. Let's go ahead and jump into our agenda. So today's agenda includes the ACA Processing 2024. We will give you an overview. We'll also jump into a reconciliation report and how to validate the ACA data and the certification process. Then we'll walk through a demo and cover Cardinal HCM access. We'll open up a Q&A for everyone to ask any further questions that they may have. And we'll also provide additional support, whether that be OHB assistance, Cardinal assistance, or ACA support materials. I'm going to go ahead and pass this over to Sarah to begin.
Good morning. Thank you so much for taking time out of your busy schedules to join us. We have some exciting new information to share with you this morning, so let's go ahead and get started. We are going to talk about running the ACA Reconciliation Report. We're going to talk about how to validate that data and complete your ACA data entry certification process. There are two important deadlines for you to be aware of. You need to have run the ACA Recon Report by next Friday, December 13th. And then you have until Friday, December 27th to complete your ACA data entry certification. We're going to step through some pages within our deck to show you those processes, and then we're going to go to a demo in Cardinal to give you hands-on experience doing these things. So let's talk about the ACA process. We are making changes to the way we do this year to make things a little bit more focused on the ACA form that your employees are going to receive. If you have 49 or less employees in your group, your employees will receive what's called the 1095 B form. If you have 50 or more employees in your group, they'll get what's called a 1095C form. There's a slight difference in these forms. The B form is going to just show yeses or nos for each month that the employee and their dependents were covered. The C form goes into more details. It shows for each month whether the employee was offered coverage and then whether they enrolled in it. And then it also shows the yes or no for each month. We've made a change to the ACA Reconciliation Report's output that will more accurately reflect the data that your employees are going to see on those two forms. The way you run the report is exactly the same. You'll navigate to the same page that you can find under Menu, Benefits, ACA Annual Processing, ACA Preparation, and ACA Reconciliation Report. The run control looks exactly the same as it has in the past. You'll enter your company and the date you want to run the report as of. As always, you can only run this report through today's date. You can't pull future information. When you get the deck, you'll have these slides detailing how to fill out the run control and how to fill out the output type that you'd like. You can set this to give you an Excel output, so you'll have data that's a little easier to work with. And again, we'll log into Cardinal in just a moment and run this report and look at the output together. These slides detail, again, how to complete running that report and how to open up your output. This works the same as any other report that you're going to run in Cardinal. You'll click a series of links, and then you'll be able to open up that output. All right, now though, when you get your output, it's going to look a little bit different. You'll get one line for your employee, and that first line is going to show their box 14 and 16 values if they get form 1095C. That first value, 1A, is the box 14, and that shows the coverage that was offered to the employee. The second value in that box, the 2C that you can see under January, that's whether or not the employee enrolled or not. The blue link below will take you out to the IRS website that explains what those values mean in detail. If you have a smaller agency, 49 or less employees, that first line is just going to say 1095B because your form doesn't include those values. The second line in the output is going to show that employee again, and then a yes or no for each month that they were covered. You'll notice that the December value is blank. That's because I ran this report in November, and the report will only pull information through the current month. We also wanted to note that the value of healthcare field that remains on the report, but please remember that this is an estimate of the value. It is not pulling from payroll information, even if you're a Cardinal payroll agency. If you need that value, really a more accurate place to get it from would be either Cardinal payroll information or your own payroll systems information. But we do provide that estimate based on the coverage the employee is enrolled in each month. Let's take a closer look. So if I have a 1095C company with 50 or more employees, I'm going to get those lines that show the 1416 values and then the months of coverage. If I have a 1095B company, it's going to show 1095B for that first line and then my months of coverage. And this reflects what the employee is going to see on their form when they get it in the mail. Those get mailed out with a postmark date of January 31st. We're making this change. OHB and Cardinal felt it was important to ask you to look at the actual data that's being sent and printed on these forms so that when you're doing your reconciliations and when you do your certification, you're actually attesting to what the employee is going to get on their forms. We know this is a big change. Another change that you'll see when you run this report is that the performance has been improved greatly. So a report that was taking several hours to run should now run in about 15 minutes for our largest agencies. The report is pulling from the actual ACA information stored within our system. That information gets created each month. So this schedule just gives you an idea of when you can run the report next year when we go into next year's system. The ACA data for this year is being run as we speak, and we expect to be available to you later today. Generally speaking, by the first, we'll create that ACA data for you on the second day of each month, and then the report will be available to run for that month. All right, so this slide is just sharing some information, the same reports that you've used in the past that are going to help you validate that information and complete your ACA data entry page. As you recall, on that data entry page, you're going to attest to the number of employees and the number of full-time employees, and so you can use these reports to help you get those counts and validate your ACA recon data. The next few slides are just going to give you reminders on how to run each of those reports and the navigation to them. The Cardinal Enrollment Report is exceptionally useful. It'll pull all employees on your report and anybody who was terminated within 90 days, and it'll list out all of their coverages and is available as an Excel output. The Enrollment Changes Report will allow you to run a window of time and anybody who had a change within that window of time. And the base benefit consistency audit includes a number of different detailed information. It's got employee data and dependent data. It's looking for things with invalid social security numbers. It's looking for maybe some mismatches in enrollment information, like a spouse who is covered both as themselves as an employee and as a spouse coverage. We suggest running this on a regular basis so that you can make sure that you're not running into any inconsistent data. Once you've gotten that ACA report completed, and again, that's due by Friday, December 13th, you'll need to go into the system and complete the ACA data entry process. This process is critical. If your group doesn't complete this process and certify your data, then when we create the file of forms to be printed, that group will not be included. So this is a crucial piece into ensuring that your employees get their ACA forms in a timely fashion. Once you complete the information, there's a very important I agree checkbox at the bottom. You'll click that and save, and then you'll be completed your ACA obligations for the 2024 reporting year. So let's go into Cardinal now and take a look at this report and the changes and go through the ACA certification process. All right, so I'm logged into Cardinal as a benefit administrator. Let's navigate to the ACA Reconciliation Report. So I'm going to click on the compass icon in the top right corner to pull up my menu. I'll click the menu. It'll bring me to the beginning of the menu, and then we're going to select the benefits folder. We're going to select the ACA annual processing folder and the ACA preparation folder. And that'll bring me to my ACA reconciliation report. All right, I'm going to enter my run ID. I'm going to use a 2024 run ID for this year. You can use an existing run ID or you can create a new one. You just need a value here. So we'll click search. It'll find that run ID and pull up the page. Again, the page looks exactly the same as it has in years past. We're going to use GMU as our sample company today. So I've entered in a company of GMU, and I'm going to run this report as of today's date. I'll enter the company and my date, and then I'll click the run button. The report will be selected as what you're going to run. I'm going to change the format from text to Excel so that I get a nice Excel document that'll be easy for me to work with. And again, that's detailed in the deck that you'll get a copy of after today's presentation. I'll click OK to submit the job. You'll notice now on my screen, I have a process instance number. That means the job was successfully submitted and is running. I'm going to click on the process monitor link to see that happen. This will run for just a few minutes and will be completed. I have a sample report ready though to show you. Once this report finished, we would have clicked the details button, the view log trace button, and that would have pulled up the output for me to click on. Those screenshots are also detailed within your deck. But let's go to our ACA data. So this is a sample output that I've produced for a 50 or more employee group, right? So this group is going to get a 1095C. Let me make this a little bit bigger. And you can see the output looks very similar to the old report. It's going to list company, department, EIN, SSN, employee ID, and name for your employee, and then their dependents. But let's scroll over to the detail and see the changes. So you'll notice that the first line is my employee, Betty Smith. We've got the value of the healthcare Betty was enrolled in this year. This first line is going to show her box 14 and 16 values, the offer of coverage and the acceptance of coverage. She's got a 1A and a 2C all through the year through November. And again, I ran this report last week for us. So you'll see December is left empty, just like the report now, right? Right now in production, if you were to run this report on any given day, it would only show you data through the month that you're in, and that'll be the same. But since we're in December, when you go to run this report, you'll have values in there for December. Let's take another look. So our employee Betty is on the report once to show her box 14, 16 values. She's on the report a second time to show her months of coverage. So Betty enrolled in coverage January through November. She's been a full-time employee for several years and has not made any coverage changes, right? We're also showing Betty's dependent on the report. So John is on there as well. We've got John's date of birth, and then we've got John's coverage of months. All right, and that will show on the 1095C this employee is going to get. On one section of the form, it'll show the box 14, 16, and then there's a section for all the coverage months, and it'll list there the employee and all of their dependents. Okay, if I go to run this report and one of my employees is not on the report, it means the system has not created a form for this person. So there may be something wrong. That would be a good point to put in a ticket to VCCC with Cardinal in the subject to ask the PPS team to take a look at the data to figure out why this person is not getting a form. All right, so if they're not on this output, then they're not no form is about to be generated. So that's definitely one of the things that you are checking for. Okay. All right, so it's going to go through all of your employees. If the employee, like this next employee, right, our O2 employee doesn't have any dependents, so it's just the employee on the report. I'm sorry, this one does have dependents. So we've got our employee and then several dependents listed under this record. So we're going to get the box 14, 16 values for the employee and then the months of coverage. You can see this employee had a change, right? Their offer of coverage changed from May to June. Looks like this employee terminated in May, coverage was no longer offered, and they were no longer enrolled. Okay, and again, if you use that IRS link within the deck, that will explain all of the values to you. Our next employee doesn't have any dependents, so it's just the employee on the report twice. Wants to show us their box 14, 16 values, and then a second time to show us their covered months. All right, and again, this is exactly what's going to print on the form that your employee sees. So this year, when you do your reconciliation, you're making sure that what the employee is going to get in the mail and what is submitted to the IRS is accurate. Okay. Let's say the company that we had run for was a smaller company, a company with 49 or less employees. Let's take a look at what their report would look like. So it's going to be very, very similar. It's going to have that same basic information at the beginning of the report. But as I scroll over to look at the months of coverage, you'll see each time now in that offer of coverage line, it's just going to remind me that I'm a 1095B group and my forms don't include that information. My form is just going to list the employee, any dependents, and the yes or no for each month. And so that's what you'll be validating. So let's take a look. So in this example, John Smith was covered January through November. So he gets a yes for each month. Further down on the report, we see that this family, right, we've got the same EMBL ID and we've got several dependents listed. So the employee again is going to get that 1095B for their months of coverage, for their offer of coverage line. And then the dependents are just going to show their yeses and nos for each month. Dependent date of birth will populate if we have it in the system. And again, that value of healthcare will also populate in, and that again is an estimate. All right. So we understand this is a significant change to the output, but we think this is an important step to make sure that we are validating what is going to show up on the employee's form in the mail and what will be submitted to the IRS. If you go to run the report again and you see information that is missing, an employee isn't showing, please submit a ticket and the PPS team will help figure out how to get that data out there. If you have questions about the form values that you're going to see, again, we're going to refer you to those IRS guidelines. You can also reach out to OHB, but they'll have to also refer you to the IRS guidelines, as that's really the legal definition of those forms and how they get assigned.
Sarah, we have a couple of questions. One of them from Sarah Landis is, I've run these reports for each month this year, but it didn't contain the 1A, 2C, or similar designations. Do we need to rerun each report?
So we have made a change to how this report works last night. That was moved into production so that you wouldn't see it before we were able to explain it to you on the forum today. So when you run this report, you're going to see different sets of data that come out of it. I would run the report this week, especially by that December 13th deadline, and give a good overview to the entire year's worth of data.
Okay. The next question is, we have thousands of employees with and without coverage. How do you suppose we would validate that data?
So you're going to do that the same way you would have done in the years past, right? So in the years past, it was going to show you the best codes. The employee was full-time and they were enrolled, or the employee was full-time and they waived. This time you're going to get the employee was offered coverage and the employee enrolled. You can use that Cardinal enrollment report that's going to show you the enrollment for each month or for each day that you run it by, and you'll be able to bump up that information to see that the form reflects the coverage in the system.
We've got several people that have said they have more than 100, more than 50 employees, but they are showing 1095B data.
So we ran a process this morning to create all of this data, and it ran into a hiccup. It is rerunning right now. So I'm going to suggest that you wait until the end of today to run the ACA Recon report. And if you have issues with that, then please let us know. When the final determination comes down to what form your employees are going to get, it's going to come from your ACA certification page. You haven't done that at this point, right? You've only run the recon report. You haven't done your certification piece. So when we do the recon data, we are counting up the number of employees in your group and guessing whether you're a 1095B or a 1095C. So there's a possibility that, the data that's running right now just hasn't put enough employees out there for you to hit that. But again, wait until the end of today and submit the report. It runs much, much quicker than it used to in the past. I believe our old guidance was kick this off before you leave and it'll be ready in the morning. Now, when we run this report for our largest agencies, we're seeing it complete in 15 minutes. Okay. And then again, any questions about what the individual code values mean, really you'll have to go out to that IRS website. If you Google ACA values, you'll see lots of cheat sheets out there that try to give you a plain language description of those values. But at the end of the day, it's the IRS definitions that you should go by. Okay. All right, so we've had a chance to look at what the output looks like, whether I'm a 1095C, 50 or more employees, or what the output is going to look like if I'm a 1095B, 49 or less employees, right? It's the same output you saw in the past, except now it's going to show me the coverage that's reflected on my form based on whether it's just months of coverage or whether it's those offers of coverage as well, okay? All right. In your deck, we've got detailed screenshots on how to submit that Cardinal enrollment report, that Cardinal change report, and the base benefit consistency report. So we'll let you refer to those to run those items because those are the same reports you've used in the years past to pull this data. Let's go over to the ACA data entry page and do a demonstration of that. So the menu is going to leave me where I left off. So I'm going to click on the benefits link to go back a step. I'm going to click on the employer information folder, and then I'm going to click on the ACA data entry page. I'm going to enter my company code and click search. All of the years that my company has been participating in ACA will show up here. We need to do the certification for 2024, so let's select that. The form is going to be populated with some information based on how you submitted this last year. So it's going to pull in the contact employee who did this form last year. You can see Betty Benefits was responsible for doing this ACA work last year, and it's going to pull up that same person. If Betty isn't the person doing this year, right, then you would click on the search icon and you would look up your EMPL ID and select that. And then that would populate in your contact name and your phone number. Okay. The phone number that's listed here is the phone number that's going to be printed on the employee's ACA form when they have questions. So make sure that that's the information that you want to show. If, let's say, you're a large group and you don't want to have this tied to a specific person, you can delete the EMPL ID from that field. And you can go in and select, you can type in the contact name, right? So maybe this year, a different person's going to do it. So let's say this year it's going to be benefits Ben, and we want them to call our generic phone number. So we'll type that in. And I can leave that like that. I don't have to have a contact EMPL ID in that field. If I do use a contact EMPL ID, employee ID, then it's going to pull the name and phone number that's registered within Cardinal for that person. Okay, so very important to make sure that you check those phone numbers. In the years past, information is pulled in from the system, and because somebody had selected their home phone number as their preferred phone number, that was the number that was printed on a form. You definitely don't want to get these phone calls at home. So please be sure to check the contact name and phone number on this page. All right. The ACA reporting indicator will be set for me. For all agencies, this will be set to yes. You can't opt out of ACA reporting. The next thing it's going to ask me is that, in general, 50 question. If I say yes to this, I'm going to get a 1095-C for all of my employees. If I say no to this, I'm going to get a 1095-B for all of my employees. So very important that you answer that accurately to make sure the right form is produced for your employee group. All right. Then I'll have to go in and enter counts. For each month, it's going to ask me how many full-time employees did I have and how many part-time, or excuse me, I'm sorry, how many total employees do I have? The system will give you checks if you try to say that I had 11 full-time and 0 total. It'll say, well, you can't have a greater full-time count than you can the total count. And it'll check that for each month. So we'll go in and we'll say, let's say this is going to be a no group, right? We were a smaller group. So we had 11 full-time employees and 12 total employees, and we stayed that way for most of the year. We'll go ahead and enter all these numbers in. Let's say we went up by 1. Right, and then I'll go back through and I'll enter in all of my total employee counts, and we'll make sure that that number is greater than the other number. We added a part-time person in March, so we'll increase that by 1. These counts get included in the file that's submitted to the IRS as part of the agency's profile, so it's very important that they're accurate. I can put all of this information in. I can save this for a second and say, I'm just gonna, oops, I've got a bad character in that one. I'm gonna save this and pause here. I'm gonna run some more reports and look at some more data before I finalize all of this, right? Once I'm completely set that this is done, I'm gonna click the I agree button, and then I'm going to save the page, okay? My certification information will pop up here saying that that is done. Once I have certified this information, I can't make any changes. You would need to either reach out to OHB or the Cardinal team through a VCCC ticket to make a change. All right, I can leave this now because I haven't certified, and I can come back in and I can make a change. We're gonna say the contact name is now Sally. And I ran another HR report that gave me better head count. And so I'm going to increase these numbers in a few places. I can make as many changes as I want, save that information and return to it. Once I certify, then I've completed this process and I can't make any changes. So it's important to make sure you're done when you're done. If you realize after the fact that you need to get something updated, please reach out to OHB or the Cardinal team through a VCCC ticket. Again, to complete this process, I'm just going to click this checkbox. My certification name and date will pop up, and I'll save the page, and I'll be completely finished with my ACA information for the year. Okay.
We have someone who would like you to show them where you went to get to this ACA data entry page.
Sure. I'm going to save this page and I'm going to go back to the home screen. So to get to the ACA data entry page, I'm going to click the navbar compass icon in the top right corner. I'm going to click the menu item. I'm going to click this menu item to take me back to the beginning of my menu. Okay. Then we're going to click the benefits folder. We're going to click the ACA, the employer information folder, and the ACA data entry page. All right, I'll enter my company and I'll click search. And then I'll pick this year from my results, right? We need to do our 2024 certification, and that'll pull up your ACA data entry page. Okay, again, this ACA data entry page is due on Friday, December 27th. That'll ensure that your employees are included in the file that's sent to our vendor for printing. Those forms will be printed by the end of January and mailed out. Okay. All right.
Another question that people have is related to people who are just hired. Maybe at the end of November, they have the 30 days to select their coverage. What exactly is going to happen as if they potentially haven't enrolled in coverage yet when they start to run this process in these reports?
Yeah. So, everything is a point in time. So when you go to run the report on, December 3rd or December 4th, if that employee hasn't enrolled in coverage yet, right, then you won't see them listed there on the report. So you hired someone in November and their coverage is effective December 1st. You're going to go into the system and enroll them in their coverage, or they're going to hopefully go out to self-service and enroll themselves in coverage. That coverage will be effective December 1st. Once our ACA data process gets updated throughout the month of December, then when you run the report again, you will see it there. So we'll share a processing schedule with you after today's meeting, so you'll know when you'll be able to see changes in that ACA Recon report. If you're doing your ACA data entry page right now and you know that you've got a form on your desk to enroll that person, they're a full-time person, you can include them in your counts because those are just employee counts. But the ACA data itself will have to get refreshed throughout the month to pick up that new coverage. That's a great question. Okay. And, a form like that for that person, it's going to show that for January through October, they were not an employee at your company. There's a code that says this person was not employed during that month. And then they'll get a code for November saying that they were in their waiting period. And then they'll get a code for December showing that they were offered coverage and if they chose to enroll in the coverage, if that's the choice that they made. An important thing to remember as you're looking at this ACA data is that Medicare enrollments are not communicated on COBA ACA forms. Right? So if you have an employee who is currently 65 and enrolled in a Medicare plan, once that enrollment changes into a Medicare plan, that coverage will not be communicated on the ACA Recon report or on the ACA form they receive. Okay, again, Medicare coverage is not reported by COBA on your forms, so it will not show up on your ACA Recon report. So if you have an employee who is still a full-time employee, but has been enrolled in Medicare all year, they will not receive a form. You should not see them on your ACA Recon report. Okay.
Just a follow-up, do I need to worry that the certification numbers don't include that employee as covered?
So the certification numbers don't talk about coverage, right? Let's scroll down and take a look at that again. So the questions that you're asked for these counts are, how many full-time employees did you have? And then how many total employees did you have? There are no qualifications here about coverage. This is just about head counts. So when you're getting these numbers, you're really looking at, HR reporting to know how many people you had each month that were full-time and how many people that were covered. Elsewhere in the reporting that goes to the IRS, coverage counts happen, but that's going to pull from that ACA Recon data. You are not asked to provide those counts or enter them. Okay, so you're just going to give full-time counts and total counts.
And then one more follow-up on that is what day of the month is that as of?
First. So you have an option as an agency on how you're going to do that. You can choose the first of the month or you can use the last day of the month. But as long as you're consistent throughout your process, that's up to you. So whatever is sort of, whatever makes more sense for you reporting wise or ease, but just make sure you're consistent with both counts. So you're giving full-time as the first of the month, and then you're giving total as the first of the month. And if you're going to do that for January, do that for all 12 months. If you'd like to use the last day of the month, make sure you're doing that for both your full-times and your totals, and you're doing it for each month. Okay, so first of the month or last of the month, but make sure you're consistent for both counts and throughout the year. Okay. All right, this brings us to the end of our demo. Why don't we pause here for a moment and we'll let you enter in any questions into the Q&A section. We'll take a glance over to those before we resume back with the presentation. We've had a chance to review some questions in the chat, and I think we're going to read out a few of those.
Okay, the first one is, are we supposed to do this monthly or just annually?
Okay, so the ACA data entry piece, you just have to do that annually. That happens once a year and it's due by December 27th this year. The recon report, you are required to run by Friday, December 13th. We recommend running it on a more regular basis. If it makes sense for your agency to look at this monthly, that's great. If you can only look at it quarterly, we understand that too. Again, the data only will be out there through the current date. So when you run it now, you're going to look at all of December or all of the year, right? When you start to move into this new process for next year, you can look at the schedule we gave you, and a few days into each month, the recon report will be available for you, so you can keep on top of it throughout the year. Again, if let's say you had an employee who, there was an issue processing their transactions and the transactions were entered late, right? You may say, well, I ran the January report and it was fine. I don't ever have to look at January again. But in February, you had to make a correction to that coverage, right? The employee reported a birth that happened at the end of January that didn't get into Cardinal until sometime during February. That's going to change your January information, right? So there's always a sort of a look back piece to this. And at the end of the year, you're probably going to want to, check all of the months, even if you've been running this throughout the year.
Okay, thanks, Sarah. The next question is, are part-timers included in the full-time counts if they're considered benefits eligible?
No. So your part-timers, even if they're being offered benefits, they'll show up in your total employee count. That full-time count is restricted to your, your employees who are coded as full-time within Cardinal. Okay.
If there is a blank area after 1A, is this an error?
Not necessarily. So under certain circumstances, and this is a really great question, your box 16 could be blank, okay? So it is very valid that the employee could have been offered coverage and then not have any corresponding box 16 value. You should have something for, no, that's a valid combination, okay? And I think I saw one about if I'm a small agency and I can get this all done today, can I? Absolutely. There's no waiting period on completing your ACA data entry page. The quicker you have completed this, the better off you'll be, and you'll end up on the OHB Gold Star list. At the end of the year, they'll be in a serious crunch to check any form that's not finished and then reach out to you to get that finished. And so that, we have tight turnaround deadlines. These forms have to be printed and postmarked by January 31st. So hitting that December 27th deadline is critical, but you are absolutely free to get everything completed this week if you can. That's highly encouraged.
If I have a part-time employee, should they be included in the total figure, even if they did not work on the first or the last day of the month?
So if you're doing first of the month and your part-time employee got hired in the middle of the month, then you would not include them in the total, right? If you're doing last day of the month, then you would, right? They don't have to be employed for the full month. If you're doing last day of the month, just you pick a style for your agency. If you're going to do first day of the month, just be consistent for both those counts, and be consistent throughout the year. Okay. All right. I think we're going to stop the demo piece now, and we'll transition back over to our PowerPoint deck. And again, we'll continue to watch the Q&A. If you have questions that pop up, please enter them in there. But now is an important time to talk about access. If you are one of the people who was struggling to navigate along because you clicked on that compass item and you didn't have all of the things that you saw me have, you may have lost your access. So we're going to talk to you now about what to do.
Core user access is required to complete this process in Cardinal. If you have not logged in 90 days, you have lost your access, and to get your access back, you will need to submit a Cardinal security form. So you'll need to reach out to your CSO to submit that. And logging into Cardinal, log into Cardinal using my.cardinal.virginia.gov. We do recommend that you bookmark this page for easy access. and a valid email address is required to access or log in to Cardinal. So if you are a new non-code Cardinal user, you will need to complete a one-time registration and establish an Okta multi-factor authentication. And to successfully register your account, you need the following items. You need your email address as recorded in Cardinal, that's important. You'll need your 11-digit Cardinal employee ID number and your last 4 digits of your social security number. If you do not know your 11-digit Cardinal employee ID number, you need to reach out to your HR administrator to get that to you. And refer to the Cardinal registration guide for active employees for step-by-step instructions. And if you're not sure if you need to register, visit the Cardinal portal page on the Cardinal website to determine if you need to register for Cardinal access. All right. We will go ahead and open up if there's any questions.
If you go to log into Cardinal and you don't see all of those folders, when you go to the menu, it's because your access has been restricted because of lack of login. So definitely reach out to your Cardinal security officer today to get that resolved. They need some time to be able to process forms. And so in order for you to get those deadlines met, again, it's Friday, December 13th to get the report completed by, and Friday, December 27th to complete your ACA data entry. Again, as we shared, the process that's creating all of that ACA data is running right now. So we anticipate that being out in the system later today. We'll share with you when that's complete on the board. We'll put on the Cardinal message board when that process is complete to give you the okay to run the report. If you'd like to just wait till tomorrow, that's fine too. We're confident that when you run the report tomorrow, you'll get a complete picture of the data.
Let me ask you this one, Sarah. If I want the contact information to be mine, but someone else will be completing the certification, is that okay?
That is okay. So if you want the contact name and phone number on there to be what's in the system for you personally, put your EMPL ID on that data entry page. If not, just delete out that EMPL ID and type in what you want as the contact name and contact phone number. For the certification piece, it's going to be whoever is logged into the system to do it, right? So if you want your, if Ben doesn't feel comfortable certifying the data and he wants Betty to do it, Betty needs to log into Cardinal and go to that ACA data entry page. She'll list Ben as the contact name and the phone number that you would like calls to go to. And then because she's logged in, when she clicks that I agree button and clicks the save button, it will say that Betty certified this page. It'll save that certification information. It's whatever user is logged in and clicks that button. Okay.
There's one more question. Will transfers show up for the full year with a Y? Or will you just see them for the months on your agency?
You should just see them for the months in your agency. That if a transfer is going to get 2 forms, right? So they'll get a form for the first employment period and they'll get a form for the second. And those Ys will switch from one form to the other, showing where they had their coverage from. Okay. So we understand that this is a big change to the data. The Cardinal PPS team is standing by and ready to resolve your VCCC tickets. We'll put all of our attention to that over the next couple coming days. We'll have very quick turnaround on any reporting issues that you run into. But again, refer to the IRS website for explanation of the codes. But you would definitely reach out to us if somebody isn't on the report. And if you have questions about the data, we'll do our best to help direct you to the right spots. Okay.
Okay. So if you have a question about the ACA Reconciliation Report values, or you need assistance determining the correct data, or just general healthcare questions, contact OHB, especially for any corrections that you need to make after you certify. For Cardinal support, like Sarah said, if something is not working, you have technical questions, anything about a report, go ahead and submit a VCCC ticket, and Cardinal will put every effort into resolving your issues.
Great. You can also be on the lookout for an e-news that's coming out from OHB. You should receive that today with some more details for you on the ACA process.
And some Cardinal ACA support materials. We have a couple job aids. The BN 361 ACA data entry has the detailed steps for completing the ACA certification process. It will help you with navigation and any assistance you may need. We also have the BN 361 BA contacts with an overview of any benefits administration contacts page and guidance on how to update the contact information. Reports for ACA are highlighted at the beginning of this deck, so you can go back and look at that if you need some more details. We have the reports catalog for the benefits that include reports and queries for the benefits functional area. And if you don't know how to run a report or you need help running a report, you can use the NAV 225 generating an HCM report job aid. And as Sarah mentioned, if you don't know what any of the indicator codes mean or you have any questions, you can go to the IRS website as linked here, and they can give you those values. Well, thank you so much for attending our forum today. A slide deck, copy of the presentation, and recording will be distributed this week. Have a great day.